Thank you for joining me today. In this video, you will learn motor disorder. Motor disorder it is a neurodevelopmental disorder, and it includes developmental coordination disorder. It includes stereotype movement disorder, tic. Motor disorder are subcategory of neurodevelopmental disorder characterized by abnormal motor behavior that interferes with the function. Onset is in a childhood and teenager before 18. Not explained by other neurological conditions, substance or medical disorder. Motor disorder include the developmental coordination disorder, impaired in inadequate or executive of a coordination motor skills, manifest by the clumsiness, slow, inadequate of a motor performance, interferes with activity of a daily living, like dressing and eating. Academic, it also interferes in school, academic, productivity, not due to intellectual disability or neurological disability. It's not included, it's motor disorder. Stereotypic motor disorder is a repetitive, non-functional motor behavior. Examples include hand clamping, body marking, head banging, and may result in self-injury. Begins in an early developmental period, specific with a self-injury behavior, without self-injury. Tic disorder is a sudden, rapid, and recurrent non-rhythm motor movement or vocalization. Wax and wane, can be temporary and supported. The onset of a tic disorder is before 18. Types of tic disorder include disorder that happens after two motor tics and one or more focal tics. So the assessment is this person with the tic disorder has two or more motor tics and one or more focal tic. Duration is more than 1 year. Persistent chronic motor or focal tic disorder, motor or focal tic, not both, and duration is more than 1 year. Professional tic disorder is a motor and focal tics. Duration is less than a year. Common clinical features include higher prevalent in a male, so it's common for male. Symptoms worsen with stress, anxiety, and fatigue. Improvement during the focus activity often combined with ADHD, OCDs, anxiety disorder. So motor disorders are combined with this diagnosis. Differential diagnoses include cerebral palsy, it's static neurological deficit, seizure disorder is an abnormal EEG, and loss of a conscious. Autism spectrum, medication-induced movement disorder. So those differential disorders have a common with a motor. They have with them some of the symptoms of this differential diagnosis. They have a motor disorder. Treatment and intervention for motor disorder. Core principle: behavior and rehabilitation therapy are the first line of motor disorders. Treatment is a symptom focus. So you will treat the symptoms if they have depression, anxiety, ADHD, but there is no treatment, the medication for motor disorder. Developmental coordination disorder, you wanted occupational therapy is the first line of treatment. Physical therapy is the other treatment. Task-oriented motor skill training will help with the coordination. School accommodation, extra time, reduce motor demand. No medication indicated for motor deficit. A typical motor disorder include behavior interventions, habit and reversal distraction, environmental motivation, protective equipment, because they will be hitting their head, they will be hitting their legs. So there has to be accommodation to prevent them to injure themselves. Treatment: treat the underlying and comorbidity conditions like autism spectrum or ADHD, anxiety or depression. Tic disorder, behavior treatment is the first line for mild to moderate. Comprehensive behavior intervention for tics. Habit reversal training. Pharmacology treatment to moderate to severe impairment include alpha-2 agonist, antipsychiatric for only severe. So they include guanfacine, Raspadal, Barbazal treat the combination of comorbidity, ADHD, OCD when persistent. Prognosis. Many motor disorders improve with age and intervention. Tic disorder often decrease in adulthood. Early identification improve functional outcomes. So, motor disorder is a observable movement abnormality. Occupational therapy and physical therapy are more important than medication. Cognitive therapy is the first line for tics. Tardive requires both motor and focal tics. Rule out the medication and neurological causes for the motor disorders. Thank you for joining me today. I would love to see you in my next video, and please subscribe. Thank you.